Hi, welcome to our series, Know the Issues Before You Vote. Today we'll be discussing healthcare in our current healthcare system, and we're lucky to be joined by Dr. John Paschen. He has been a pediatrician at Ames for 30 years, so he has a lot of experience, and he has seen various forms of healthcare come and go and those things. He has also served on a volunteer medical missions in the U.S. and around the world for over 25 years, and he is currently the chairman of the Story County Board of Health, where he has also been a member for 25 years. So as we've been doing with these, we just let you speak about whatever you want to speak about to help inform voters.
Okay. All right. Well, Mary, thank you very much for having me. The thing I'd like to talk about tonight is because this is in many respects, one of the biggest health as well as political issue of our time, and that's COVID. COVID first hit the state of Iowa approximately March 11th, 15th, somewhere around there. And the thing that has bothered me the most about this epidemic is that we have gotten no leadership from above. Considering the whole country is affected by this, considering we've had over 200,000 Americans die, about a little over 1,000 Iowans die, we have not had good leadership of what to do, and we felt like we've been on our own from day one. When COVID hit, we started to do mitigation measures in our department. Those are continuing to go on, but still it seemed like everyone was floundering. During the summer, our governor said that schools had to open in the fall, but they gave them no guidelines to how to handle this disease. And it shocked all of us. We all, when we heard that statement that schools will open in the fall, we thought, well, the governor's going to give us guidelines with the Iowa Department of Public Health. It never came down the pike. And so each school district was forced to find their own plan. Some were good, some were not good. And it's like we just really needed some guidelines, but we've always felt like we've been on our own. And it's only upon our individual efforts that we're actually starting to stem the tide in some areas in the state and the country.
We're dealing with a multi-level crisis, a healthcare crisis, mental health crisis.
Oh yeah.
Poverty. Yeah. I mean, it's just steamrolling.
Mental health issues that I see in my office is I've seen kids be so stressed. I've put more kids on medication, sent them to counseling in the past 6 months than I have in the past 4 years. This is really stressful on families. It's stressful on my patient population, the teenagers, the young kids. I find myself reassuring young kids who are terrified of the virus. And they see what's going on. They see that people are floundering, that we don't have any good guidance, that we don't have leadership. And this is like really, this should not continue. It just blows me away that what he's not doing, it's kind of like the president before Roosevelt during the Depression. Who was it, Harding, I think? He didn't do anything about the Depression. He didn't do anything. He thought it would just go away. They kicked him out. We got a leader that actually did something and helped America get through this very, very difficult time. We need leaders like them again. And right now, they are not in Washington.
So I don't want to get you, I mean, I know there's confidentiality, but like when you talked about the patients that you see, your pediatrician, and the level of stress that they're going through, is it because of the isolation, or is it just do you think a lot of it's just the whole family stress of finances and, I mean, everything's...
Yes, It's all those. The stressors that families are feeling, um, reverberations that will go through the whole community because certain people are not working during this epidemic. These type of effects don't just affect one person. When enough of them are affected by it, it goes throughout the whole community. And the thing that really is phenomenally disturbing to me on the data measurement is how this crisis, both economically and health-wise, is not an equal um, disturber. It is taking people down who are of color, lower socioeconomic background, at a higher rate, and the economic burden is much greater on those at the lower end. It's such an unequal crisis, and it's a hard one. This is a hard one. My daughter, who is in the restaurant business, and so you can understand how she's doing. She's a writer and an avid reader, and one of the things that she brought up was that during the Spanish flu, that there was not a lot written about how people acted during that time. During those 2 years, when there was approximately 25% of Americans who died from the Spanish flu alone, and everybody knew someone who died from it. There's not a lot written about how people handle that, about what they did. And the thought is that because when all was said and done, they were ashamed about how they acted. My hope is that for me personally, that when this is over, I can look back at it and be very proud of what I did. I tell this to my staff all the time.
Wow, that's wow. Thank you. That's very, very good. So I also wanted to ask you about the Supreme Court overturning the ACA. Another dark, heavy, deep topic, but I don't think everybody realizes everything that the ACA covers. Like, you get to stay on your parents' insurance until you're 26. I mean, this affects everybody, not just people who use the ACA.
Right.
So can you maybe talk about how you think that could affect your practice if the ACA is overturned?
Well, let me tell you how the ACA has affected my practice and the practice of medicine in general. First of all, a lot of people have the fallacy that there's things in the ACA that were there before the ACA got put into play. Like, one of the things that I've heard in the doctor's lounge is, oh no, we've always been able to keep our kids on our health plans until you're 26. And it's like, no, you're a little confused, because the ACA was put in at different steps. And that was one of the first things that they put in. So people think, oh, well, that's not the ACA. That is the ACA. Mm-hmm. One of the things that happened when the ACA was in full play, the ER noticed that there was a significant decrease in the amount of people coming into the emergency room without insurance. It just kind of dropped off the face of the earth. We in Ames changed our focus on giving medical care to not people who didn't have insurance in the free clinic, but then it got switched over to people who were immigrants and couldn't get on the ACA. And those are the people that now, and the free clinic actually, thank God, was allowed to be closed. My brother-in-law used to work in the free clinic in Clinton County. ACA came in, got closed, didn't need it anymore. Because one of the things the ACA did was that all insurance policies had to have these basic coverage, the basic things that they covered. I don't think the ACA is enough. I do not think it's perfect. But man, we should build on it. We should not throw it out.
Exactly.
We can make this we can make really getting us having true coverage.
And again, through the COVID crisis, with so many people losing their jobs and their insurance is tied to their employer.
That's right.
And then if you take away the safety net of the ACA, you know,
Yeah. Right.
it's
Yeah. Oh, right. Oh, yeah. Yeah. I understand what you're saying. Yeah, that's absolutely right. You know,
and I think, I'm sorry, and I think a lot of what I've heard from other physicians is that their practice was able to go from trying to treat emergencies to prevention, more preventative healthcare.
you know, that really may be true. I'm a pediatrician, so I practice preventative medicine virtually every single day. And so, yeah. And the other thing too is if they can get in to see you sooner, all of a sudden you're not dealing with a pneumonia that has to be put on a ventilator. You're dealing with a pneumonia that just needs a little bit of amoxicillin,
Mm-hmm.
which is
Yeah,
cheaper, by the way. And that's
yeah.
and that's kind of the interesting thing too. When the ACA came into effect, it actually decreased the rate of rise of the cost of doing medicine the first time in 25 years. Medicine, now it still was rising, how much it costs to give medical care, but for the first time that rate started to decrease. And they want to
Well, and as a respiratory therapist, what I have seen is lung cancers are getting diagnosed earlier because they now do a standard low dose contrast CT when you go to a pulmonologist.
Yeah.
Lungs, it's just standard now because it's now covered.
Yeah.
And if you do smoking cessation with it, then there's another benefit. But anyway, so it's all of these things that I don't think people realize, that you may have Blue Cross Blue Shield, but your low dose CT contrast is now going to be covered because it's part of the it's all together.
Right. Exactly.
Yeah.
So
Yeah.
So this is I don't think this is a good I do not think this is a good turn. The fact that they're pushing this nominee is the ultimate hypocrisy I've ever seen in politics, and I've seen a lot of hypocrisy. This is the ultimate. Voting is the single most important thing you can do to change the way that our country is going. I was able to vote when I turned 18, and I have missed, except for maybe a couple city council races, I have not missed a single vote. It is one of the greatest things that we can do in this country. In other countries where the right to vote is not a given, when it is finally given, people will stand in line for 3 days with the opportunity to vote. And we still only have a turnout of approximately 40 to 50%.
I think it'll be higher this time, but yeah.
That's our hope. That's our hope. Time for people to vote a change in our country.